Pims pediatric inflammatory multisystem syndrome is a serious condition that appears to be linked to COVID-19 in children. It is characterized by widespread inflammation in multiple organ systems, similar to Kawasaki disease, and can occur weeks after a child has been infected with the coronavirus. This condition is considered a rare but serious complication of COVID-19. Key features of Pims symptoms. The symptoms can vary but generally include fever, abdominal pain, vomiting, diarrhea, rash, conjunctivitis, red eyes, swollen lymph nodes, skin rash, signs of heart problems, chest pain, rapid heart rate, affected organs. Pims can affect various organs, including heart, lungs, kidneys, gastrointestinal tract, central nervous system. Age group. It primarily affects children and adolescents, typically under the age of 18. Although cases have been reported in older children. Causes and risk factors post-COVID-19 response. Pims appears to be an abnormal immune response to a previous COVID-19 infection. It is not necessarily due to the active virus but rather an inflammatory response that occurs after the infection has resolved. Genetic factors. Some children may have a genetic predisposition that makes them more susceptible to developing Pims. Previous infections. Children who have had asymptomatic or mild COVID-19 infections may still develop Pims. Diagnosis. The diagnosis of Pims is primarily clinical, based on the presentation of symptoms and the exclusion of other potential causes. Diagnostic steps may include medical history and physical examination, detailed assessment of symptoms and previous COVID-19 exposure. Laboratory tests, blood tests to check for markers of inflammation, liver function, and cardiac markers. Imaging studies, ultrasound or echocardiogram to evaluate heart function and look for inflammation of the heart or other organs. Testing for COVID-19, PCR tests or antibody tests to confirm past infection with the virus. Treatment. The treatment of Pims often requires hospitalization, particularly for severe cases. Treatment strategies may include intravenous immunoglobulin (IVIG). This treatment is used to reduce inflammation and prevent heart damage. Corticosteroids. Steroids may be used to help control inflammation. Supportive care. This includes managing symptoms, hydration, and monitoring vital signs. Medications for heart function. In cases with heart involvement, medications to support heart function and reduce inflammation may be administered. Multidisciplinary approach. Treatment often involves a team of specialists, including pediatricians, cardiologists, and infectious disease experts. Prognosis. The prognosis for children diagnosed with Pims is generally positive, especially with early recognition and prompt treatment. Most children respond well to treatment and recover completely, although some may experience lingering effects or complications. Prevention. Since Pims is associated with COVID-19, preventive measures against the virus, such as vaccination, mask wearing, hand hygiene, and social distancing, can help reduce the risk of developing this syndrome. Vaccination is particularly important, as it helps prevent severe illness and complications from COVID-19 in children. Conclusion. Pims is a serious but manageable condition that can arise in children following COVID-19 infection. Awareness among parents and healthcare providers is essential for early recognition and treatment. If a child develops persistent fever along with any concerning symptoms following a COVID-19 infection, seeking medical attention promptly is crucial.